You're listening to the Yoga Medicine Podcast. I'm your host, Rachel Land. This podcast brings you information and resources to enhance the therapeutic effects of your practice based on a deeper understanding of anatomy, physiology, and the integration of modern science and research with traditional practices and experiences. Join me and my co-hosts Tiffany Cruikshank and Katya Bach as we dive into all things yoga, research, and wellness. Hello and welcome, or welcome back to the Yoga Medicine Podcast. As yoga teachers and students, we spend a lot of time thinking about the junction between mind and body, and we understand how deeply our quality of life is impacted by the health of our brain. Well, today we'll learn about how to use yoga as a healing modality for traumatic brain injury, one of which occurs every 11 seconds in the US. Our expert guest for this episode is Dr. Kyla Pearce, Senior Director of Programs, Research, and Operations for the LoveYourBrain Foundation, which is a national nonprofit that delivers evidence-based holistic healthcare programs for the brain injury community. Dr. Pearce has trained over 3,000 clinicians, yoga teachers, people with brain injury, and caregivers in how to adapt yoga, mindfulness, and resilience-based psychoeducation for brain injury. She also recently completed an NIH postdoctoral research fellowship at Dartmouth College, investigating the impact of yoga and meditation for people with neurological conditions, including traumatic brain injury, and has published in several peer-reviewed scientific journals on these topics. Today, she's here to share her expert insights into specific yoga tools and techniques to support those managing the common symptoms of brain injury, which include, but aren't limited to, changes in balance and perception, changes in cognitive processing and memory, and changes in mood and attention. She'll help us understand how approaches for brain injury and trauma do and don't overlap. And she'll highlight the importance of social support for what she calls this silent epidemic. So let's get the conversation started. Hi, Kyla. Welcome to the Yoga Medicine Podcast. Thank you for taking time to talk to us today.
It's a delight to be here. Thank you so much for having me.
I think we could consider this episode kind of like an expansion of our previous episode 47 with Dr. Daya Grant, which was on concussion specifically. We're going to talk today much more broadly about traumatic brain injury in general. And I think this is going to be a really useful conversation for people because it can be such a daunting thing to work with as a yoga teacher. People's symptoms and experiences vary so much. It's really easy to feel out of your depth. So I'm looking forward to hearing what you have to share with us today.
Thank you, Rachel. Yeah, I listened to that episode and what Daya, who actually used to collaborate with us at Love Your Brain. So she's a wonderful human and researcher and yoga teacher. So happy to share a little bit more from my experience and also the experience of many other people I have learned through the work that we've done at Love Your Brain.
Well, maybe we start by defining what traumatic brain injury is, just to make sure we're all on the same page, and maybe some of the most common causes.
Sure. So traumatic brain injury is caused by a blow or jolt to the head that causes a disruption in brain functioning. And not only is it common, it's also complex, but oftentimes chronic. So that's where a lot of the kind of complexity comes from, is that has an ongoing implication. And it can not only affect people physically, but also mentally, cognitively, behaviorally, socially. And more research is identifying that the neuroinflammation that happens after a traumatic brain injury, you'll hear me say TBI often, so after a TBI, is really where a lot of the therapy, the medical at least therapy, needs to focus, because that causes a cascade of metabolic and other neurobiological impacts that lead to lasting and multifaceted impacts to a person's functioning.
And it sounds like a really unpleasant Venn diagram of highly prevalent, highly complex, and chronic and ongoing.
Right. Yes. And as you said, every TBI is different. So the particular challenge also is that there's no imaging solution that can identify the specific causes and impacts of TBI. So if you think about a broken bone, you go and get a a CT scan or something that can identify the exact issue. But here with TBI, that's not possible. So it can make it very challenging to diagnose what are the exact treatment protocols to help kind of make a difference at different stages in the healing process.
So imagine some of the most obvious causes would be I live in a resort town, so mountain biking, skiing, falling, motor vehicles, that sort of stuff. What are some of the things that prompt a traumatic brain injury that might be sort of more surprising?
Hmm. Well, you're right that falls are the most common source, as well as motor vehicle accidents. Also, work related, being hit by
Oh
an object
yeah.
at work is also a common one. Um, yeah, I don't, in terms of other surprising causes, I mean, certainly there's more and more research around intimate partner violence as a common source of TBI that's very underreported, as you can imagine. So that's a kind of vulnerable community in terms of finding resources and interventions to support.
And you said everyone is different, I presume, because different regions of the brain can be affected. What are the common kind of baskets of symptoms that we would see?
Yeah, so this is another interesting arena because one of the unique things about traumatic brain injury, and that's also a bit different than other types of acquired brain injuries like a stroke or a brain tumor. So if you think of the kind of hierarchy of types of brain injury, there's acquired brain injury, and then also there's kind of hereditary or neurodegenerative brain injuries like multiple sclerosis or Alzheimer's disease that have a genetic predisposition. So that's kind of one area. But then TBI is a form of acquired brain injury, so a brain injury that happens after birth. And um, your kind of this question around the complexity of it is because TBI is often diffuse, so it impacts multiple regions of the brain. And if you think about it, since our brain is floating in cerebral spinal fluid, the site of impact, of course, is injured, but because the brain gets jostled in between the hard skull, neurons connecting one part of the brain to the other often have kind of shearing impact, so are damaged, which impacts the communication between different parts of the brain, as well as the site on the opposite side of the head. So it's a diffuse injury, meaning it impacts multiple parts of the brain, versus a stroke or brain tumor often is impacting one more specific part of the brain. If you think about a disruption in blood flow or a bursting blood vessel, that has more of a localized impact often. So TBI is very complex because it's known as a diffuse injury. The term diffuse axonal injury might be familiar to some of your audience, but that basically means the injury happens to the axon, which is part of the neuron, the building block of the brain. And that's really what causes the issue with neurons being able to communicate through neurotransmitters to the adjacent neurons to make the brain function.
Hmm. So
So,
I'm
in terms of
thinking
some
a
of the
huge
common,
basket of symptoms then, given that we're talking about localized impact, opposite side of the brain, and potentially multiple connections between neurons.
absolutely. So, yes, to your point about what are the symptoms that are common. So, mental health challenges are one of the most common impacts after a TBI. Up to 50% of people will experience some psychiatric diagnosis, including anxiety and depression being the most common. And I think the statistics show that compared to the general population, at least in the US, depression is about up to 6% in the general population, and that increases up to 43% amongst people with TBI.
And that's diagnosed. So I presume there could be X percentage of people who aren't diagnosed with a psychiatric disorder, but still don't feel like their previous self.
Right, absolutely. Yeah, I mean, actually, the Brain Injury Association of America just came out with a national survey that found 4 in 10 people are impacted by traumatic brain injury, while only 1 in 4 of those people are screened by a healthcare provider.
Hmm.
So, to your point around the kind of underdiagnosis of different comorbidities or even TBI itself, there's a
Yeah.
huge, lack of awareness.
Yeah,
So,
especially if,
mental
as you said, it's difficult to diagnose. You can't just have a scan and, yep, tick, you've got it. I can see that sort of Swiss cheese effect of things just kind of falling through the cracks.
Right. Yes, absolutely. And a lot of providers aren't often trained in
Mm.
some of the common ongoing symptoms that can happen after TBI. So there can be confusion around, is this heightened anxiety from a pre-existing psychological diagnosis, or has this been connected to the TBI itself? So
Mm.
it can be hard to tease them apart. And emotional dysregulation is often impacted and heightened after TBI. So that's one of the also common mental impacts. And then cognitively, that's really where there's a lot of common symptoms and ongoing need for intervention. So with cognitive processing, so mental fatigue is often much more common after TBI, a hard time focusing and paying attention, working memory challenges, so remembering kind of the daily tasks around where you put your keys or what the next thing on your calendar or to-do list is. So cognitive impacts, and then of course physical, so balance and sensory. Often TBI has some sort of sensory impacts. So light sensitivity, sound sensitivity can be common. Balance challenges, dizziness, especially if people have vestibular impacts. Those that can be common. And then the social isolation piece is this undercurrent of challenge with TBI because it's known as a silent epidemic. It's often not obvious on the outside that somebody's had an impact to their brain. So people are often acting different due to their injury. But without the kind of physical guideposts, many people don't understand why somebody's acting differently and therefore may not offer them the compassion or understanding that they really deserve. And so relationships can fray. So the social isolation piece is one of the most pernicious aspects of TBI.
Yeah, wow. Another really unpleasant Venn diagram there of people not feeling like their previous self physically, not feeling like their previous self mentally and cognitively, having difficulty existing in the world as it is right now, which is busy and bright and loud and overwhelming, and also potentially lacking the social support that they might need to kind of knit themselves back together and to find a way forward.
Mm.
Mm.
Yeah. Good
No
summary.
good news yet, but we'll get to some, I'm sure, when we talk about, well, maybe we talk about that now. Let's talk about what Love Your Brain Foundation is and does, because I'm guessing you saw this fairly depressing Venn diagram and thought maybe there's something I could do to help.
Mm. So, Love Your Brain came from a very personal story. So, about 15 years ago, my brother in law, Kevin Pearce, was a professional snowboarder training for the Olympics, suffered a very serious traumatic brain injury in a snowboarding accident. And at that point, my family had never heard of the term TBI before. So, sent us on quite a different direction than any of us were anticipating. And kind of fast forward 4 years, Kevin fortunately was able to receive really terrific acute and post-acute medical care. So now he is thriving, doing well, has had a really miraculous healing journey, and has had many challenges along the way. However, one of the kind of biggest learnings for our family was how common TBI was, and how, especially in the transition back to one's community, to try and kind of pick up where folks left off with their relationships, jobs, work, just community activities that brought them meaning and purpose before, um, really was where our culture was falling short. So in Kevin's situation, he was able to return to some of the things he loved, never was able to return to snowboarding, but found yoga actually about 3 years into his post-TBI journey. And that was the first time for him that he regained a sense of physical ability balanced with a kind of tuning in and calming of his mind. So Love Your Brain was founded just over 10 years ago. So we just had our anniversary by Kevin and his brother, Adam Pearce, who's actually my husband, to offer free programming really designed to build skills and resilience and community connection using a holistic approach with yoga as one of the central modalities. So we've, over the past 10 years, built a range of different programs, yoga teacher trainings and mindfulness trainings, and have conducted research and outreach to really try and change the way the healthcare system sees and integrates holistic health programs to expand access to people with TBI, as well as caregivers to support mental, physical, and social well-being.
I think that's incredible. And I mean, anyone who's ever practiced yoga, which is everybody listening to this podcast, knows that feeling of having their mind in their body in a way that feels safe and
Mm.
and calm and comfortable. That's what draws us all back to our practice, whether we have a brain injury or not. So even as you were talking about the experience of traumatic brain injury, anyone who practices yoga was already seeing how yoga could fit in, could be part of the healing piece. But that doesn't mean that people in the medical world would have the same experience or see the same the same kind of really natural transitions between things that would be helpful and yoga practice. So I think that's a really vital role to sort of make that bridge for them.
Mm. And it's been exciting to see more and more. So certainly, maybe not so much when we first got started, but more recently, there's been more and more neurorehabilitation facilities at large hospital networks who want to integrate. So we've built some curriculum, one of them called Love Your Brain Yoga, into their clinical services as a complementary and alternative therapy to support patient outcomes. So it seems like there's been a bit more of a tide shift in the kind of more traditional medical spaces, bringing in yoga-based interventions, certainly to support different neurological conditions, which has been really exciting and encouraging. Because certainly when Kevin was receiving treatment, those services and types of practices were not integrated whatsoever.
You have done some research, haven't you? And that's got to help in the traditional medical world to be able to point to research studies and, evidence-based outcomes.
Definitely. I mean, that's their entire, as you know, scope of practice is based on evidence-based interventions. So Love Your Brain has been fortunate because we've been able to both produce and partner with different academic centers in investigating the effectiveness of different types of yoga-based, as well as like a multimodal with yoga interventions for people with TBI. And I can share a little bit more about those later. But I think it's very interesting that so the first randomized controlled trial of a yoga intervention, I believe, was published in 1975, but the first randomized controlled trial of a yoga intervention for traumatic brain injury was in 2012. So that's
Whoa.
really just over 10 years ago. So it's quite kind of still a burgeoning and exciting area of research. And there is more and more. There was actually a meta-analysis published a few years ago that looked at, I believe, I forget the exact number of studies, but included about 500 participants with concussion, which is one form of traumatic brain injury, actually the most common form of traumatic brain injury, and and it was interesting, many different study designs. So the protocols involved one-on-one to group-based, from 3 weeks to 11 weeks. So sometimes hard to kind of generalize, but using this type of study to design where you pool different types of studies and look at the main effects. What they found was that the most significant improvement in yoga interventions for concussion and ongoing concussion symptoms were in mental fatigue and depression, which are, as we were talking about before, some of the most common symptoms. So really encouraging to know that specifically for TBI, there is more and more research suggesting a multitude of benefits.
Awesome. And we will talk about how to approach a yoga practice and what protocols and approaches you found the most useful. But maybe before we do, we talk a little about the overlap and the contrast between yoga for traumatic brain injury and yoga for trauma more generally. Because I think every yoga teacher these days, and probably many yoga students, have heard about trauma-informed yoga or trauma-sensitive yoga. And I presume there are some overlaps and probably some contrasts.
Yes, it's I love this topic because I think it's so exciting that trauma-informed yoga has become part of the kind of standard teaching modules for yoga teachers, which is important, knowing how I think the statistics are like 75% of people in the US will have one traumatic event in their life, and up to 8% of people will have PTSD at some point in their lives. And within TBI, I always like to distinguish that there's a greater co-occurrence of TBI and PTSD in the military population and less so in the civilian population. And research has the best estimate that between 3 to 27% of people with TBI will also have PTSD.
Okay.
And if you think about the kind of major symptom clusters with PTSD, so intrusion, flashbacks about the incident itself, arousal and reactivity, so different physiologic changes that increase sympathetic nervous system arousal and reactivity to different stimuli, avoidance, so avoiding situations or sensory inputs that could re-trigger some trauma response, and then negative cognition or thoughts and mood. So those 4 symptom clusters, there's a lot of overlap with TBI. So especially in the negative thoughts and mood and changes in arousal, so changes in the autonomic nervous system. And what makes it particularly helpful and also challenging is that a lot of the yoga-based approaches for supporting PTSD and TBI are similar, but there's also some that are different. And TBI, there's also this Venn diagram that we use in our teacher trainings that shows, a lot of the similar approaches are around supporting interoceptive awareness, nervous system regulation, and emphasis on resilience and humanity, not brokenness, clear, direct cueing. But because of TBI being often more of an impact on sensory and balance and neck pain, there's different types of kind of approaches for those symptoms versus with PTSD. It's often more about developing a sense of safety, predictability, and control, and that kind of hypervigilance that's less of an issue with TBI. So for instance, I think about if I'm teaching a group of people with TBI who I know there will be a proportion of folks who also have PTSD. One helpful example is in terms of cueing. So if I were to teach at the front of the class, a best practice is to stay stationary in the front and speak and then stop. Because from a sensory perspective, if I was giving instruction, walking around the room, that could be a lot of auditory processing for someone with brain injury. And for somebody with PTSD, it could create a sense of hypervigilance if there was a sense of unpredictability about where I was in the room. So same technique, but for different reasons. Another example is inversions, and we can talk more about benefits of inversions, but also in this situation, inversions we know can increase, for some, parasympathetic nervous system response, can have a calming effect, benefit. And for people with TBI who have vestibular challenges or dysautonomia, it can cause challenges with blood pressure, dizziness. So modifying, good to offer inversions, but need to modify them to maybe not do them as intensely or have stepwise transitioning to help with the nervous system being able to get the head below the heart.
Yeah, that makes a lot of sense.
So I think the kind of takeaway is to not assume that there's a co-occurrence, but to know there will be a subgroup. So how to think about the trade-offs of different techniques that can serve both, but also when to prioritize one or the other based on the audience that you're teaching.
Yeah, like always, we're teaching to the people in the room. And like always, when I have these conversations, I'm struck by how terrible a teacher I would be for traumatic brain injuries or PTSD. Speaking and stopping, not my strong point. So good for me to know. That's really helpful. And I think if we we're starting to get into the application side of what should we know as yoga practitioners and as yoga students. And as you're talking about the symptom clusters, I'm thinking even about something as simple in a flow class as a sun salutation being an enormous challenge for somebody with vestibular issues or balance issues, or even just issues with overstimulation, the folding forward, standing up, folding forward, standing up. So what are some of the challenges that come up with traditional, normal, usual yoga sequencing that wouldn't make sense for a group of people with TBI?
Happy to answer that. I will just say for a moment, sometimes I think, and I fear that I really want this conversation to, just your point around how you walk and talk as a teacher. I really hope this conversation empowers people to feel like they have kind of new knowledge and insight and develop more confidence instead of cause more worry and fear that people are doing things wrong. And I think a big piece that I also will share is at the very beginning. So, and this actually answers your question. We'll talk more about specific techniques, but I think something that's been really helpful for me, because I don't have lived experience of TBI. My brother-in-law does, but especially when I am teaching a community of people with TBI, I will, in the beginning of my class, share that I don't have lived experience of TBI. I've certainly taught many thousands at this point of people with TBI, and I am here to do the best with the knowledge and resources that I have, but know that I will make mistakes. So please always know that I welcome feedback, and let this be a collaborative process where you're the best judge of your body, what you need in the moment. And I will offer some ways of supporting mind body connection or whatever the intention of the class is, but really we're in this together. And I think that can sometimes help ease I need to do this the right way when
Yeah.
it's not possible to do that. It really isn't.
And again, you're talking about exactly what you were talking about before, belief in the resilience of human beings, including ourselves as teachers. If we're standing at the front of the room on eggshells, hoping that everything is completely perfect, we're not in the right place to be sharing yoga. So I was partially kidding. And partially serious, because there would definitely be some things I would think about walking into the room, like keep an eye on. But you're absolutely right. We should always teach whoever we're teaching in that place of humility and openness and willingness to create a collaborative situation, because only the people we're teaching know how they feel in their bodies, and we should always be open to their inputs and their feedback, and even some of the nonverbals, like looking at faces and facial expressions and physical reactions and going, okay, I think I need to adjust my approach slightly. I think that's really helpful advice to sort of set the scene, to make things feel less rigid and terrifying and a little bit more, yeah, here are some things to bear in mind, but you will probably make mistakes, so be open.
And I think, I will carry this story to my grave, when one of my actually favorite students had a TBI as well as complex PTSD. And I'll never forget, part of the Love Your Brain Yoga curriculum, which is a 6-week yoga, mindfulness, and psychoeducation program really designed on the science of resilience. Every week has a specific meditation, yoga sequence, breathwork practice, and group discussion focus. But one of the weeks uses a guided color, visualization, meditation, and red was the color that I brought in. And for her, that actually triggered her in a way where she left the class. And I was heartbroken and felt just like I had, failed a beloved student of mine. But having had that foundation of trust, where she knew that I recognized I was not perfect, I'd make mistakes, and really welcomed feedback and being able to learn by doing, allowed her to feel comfortable coming back to the next class. And we talked about it. But that was just a really helpful learning for me to know leaving the class was actually the thing that she needed, and to support and trust that was that was okay.
Mm. And we actually just talked about that in a yoga nidra training that I was a participant and somebody else was teaching in the yoga medicine curriculum, and setting the scene at the beginning of the practice by giving people permission to do whatever they need to do to be comfortable, including leaving the practice. It's one of the biggest gifts we can offer, because that
Mm.
leaves the door open for, but hey, come back next time. And if something comes up that isn't right for you, again, you can leave the practice. I think that's a really nice, just safety net for us all to have as teachers and practitioners, whatever we're dealing with. So I like that you shared that story. And even
Mm.
there may not have been a perfect color that you could have chosen that would have been right for every person in the room. So, you know, did you
Right.
even do anything wrong? I think probably not. You created a space that was safe enough that she could leave and come back.
Mm. Mm. Absolutely. And I think, this is also reminding me too around this question of the different trade-offs too of approaches for people with TBI and PTSD. One other best practice that I think is really helpful to also talk about here is, so this, for both populations, so teaching from a trauma-informed lens and a TBI-informed lens, is to really support a sense of agency. So to your
Mhm.
point, if people choose to leave because that's what is right for them, that is rebuilding some self-efficacy that is stripped away from the injury or incident. And so how important that is to weave those moments of choice as much as possible. And what is interesting too is from a cognitive processing. So there's a lot of talk around invitational cueing in trauma-informed teaching. So very important from that perspective of giving choice. So as you're ready, lift your arm. You might explore how it feels to take a deeper breath. Versus with TBI informed yoga, from a cognitive processing perspective, it can be more helpful sometimes to have direct cueing that limits the amount of language that you're using. So the contrast would be lift your arm up. What was the other one I gave? Take a slower, fuller breath. So not saying, again, one or the other is right, but a lot of invitational cueing can sometimes be hard to process for someone depending on the cognitive impacts of their TBI. So I always suggest trying to do a little bit of a blend of the two so that there's agency while also simplicity.
Yeah, I'm really, really pleased that you brought that up, because it's something that we talk about a lot in various episodes of this podcast, the importance of giving people choices and options. And I stand by that. It is really important to give people choices and options, but not all the choices and options and not all the time. It's similar to teaching beginners. If you give them 7 different things that they could do with their back knee and their front foot and their arms and their hands, they can just get caught in a spiral of so many thoughts, so many thoughts, so many thoughts. So there are times and places where it is really important to keep it simple, especially if you've created an overall environment of this is all optional. So if I say step your right foot forward, lift your arms, take a slower, deeper breath, and some of that doesn't work for you, hopefully you've created a place where they already know, well, I'm just going to bring my arms down because that made me dizzy or that hurt my neck or whatever. So I guess I should ask, is that something that you do? And if so, how do you create an overall permissive and spacious environment while also keeping your cueing during movement pretty succinct and concise?
I think that's so well said. And yes, so the how, well, part of it is having both that introduction that invites feedback and also really names that individuals are at the best judge of of what feels right for you in your body. And so that may look different moment to moment, class to class, but really what's going to allow this group to connect more deeply with themselves and each other is for people to choose what feels right for you. And naming that during, but then also, so the curriculum that we teach has a lot of consistency.
Mm-hmm.
And I think having the consistency within each class and then also throughout allows people to have the predictability and then know what else to do if they're choosing something else. So, for instance, we'll intentionally weave in options for mental practice. So instead of, if somebody doesn't feel like lifting their arm, offering options and doing it with the whole group first for instance, work together. And so part of the curriculum, we do these little, like from a cat cow, like little mini push-ups to help strengthen some movement in the arm. If we're doing a mat-based class, you can also do it in a chair. But before doing that, since that can be physically challenging and certainly not accessible to everybody, is to first offer. So together, we're going to mentally practice what it would feel like in our bodies to do one mini push-up. This activates the same parts of the brain that are activated when you perform the movement itself. So it has benefits to your brain. So together, imagine how it would feel to begin to bend your elbows, release your chest closer to the floor, and then straighten through your arms, imagining this in your own body.
That's great. And we talk about that here a lot too, the power of visualization, that it's not actually doing the thing is 100% and visualization is 0%. There are huge benefits from imagining, especially if you're in a body that is experiencing pain at times, imagining that movement to be pain-free and for you to feel strong and capable. Just remembering that that is a possibility for you, if not today, then at some point, can be hugely empowering, not just for the cognitive side of things, but for the emotional side of things too. Like, I remember how it feels to be in a capable body, in a pain-free body. That in itself, I think, can be really potent for people.
Right. So to empower people with this knowledge and real choice that if the experience will look different for everybody, and if they don't feel like moving a part of their body, visualizing or mentally practicing also can have benefits, and it's not a kind of woo-woo or unvalidated approach. And there's interesting research around action observation therapy specifically for people with stroke, where watching, usually a clinician with the intention of reproducing the movement, but watching and then mentally practicing. Sorry, this is actually just about watching. So we do a lot of demonstrating in our curriculum as well, because for some people that helps also prime the neural pathways that are responsible for motor functioning to then perform the movement later, but also for people who are at a part in their healing process where movement is inaccessible, simply watching fires mirror neurons and can help also recover motor functioning over time if people are watching with the intention to move, which I think is
fascinating. And I presume you tell them that, because that would make the process different. If I'm just sitting in a chair during a class watching you move versus sitting in a chair in a class watching you move, and knowing that I'm training my mirror neurons, that I'm in process, that to me would feel really different than not knowing that there was benefit to it. So I presume there's a pretty big educational piece through everything that you're doing, of not just we're doing this because it's good, but we're doing this because this is good and here are the reasons why.
I mean, it's such a good point, because I think it's, again, a balance of not wanting to overload people with information and also knowing people are in there for different reasons. Yes, certainly from a recovering functioning, and also some people are there really to connect with other people who have shared experiences and feel a sense of normalcy, and more from the emotional side of things. So I do try and pepper in a pretty succinct way about the benefits of mental practice and visualization, so that people don't discount it and really see all the benefit they're getting, but also sensitive to not having it be, I think we really try and not have it be a pathologized, kind of medicalized experience.
Yeah.
So it's a yes and.
Yeah, like most really important questions. So I'm already getting some themes come through. It's a set period of time, the practice that you do with people, so you know that you have most of them for more than one session, which I think helps, because there's room for things to develop, and there's room for you to drop one seed today and one seed next time and another seed the time after. You start each session with a sort of environment setting statement about agency and choice and how everyone's going to be looking and feeling different, and that is completely fine and normal. And then as you start the movement piece and the practice side of the piece, you are placing value on visualization and on observation as well as participation, and trying to keep your verbal cues succinct and simple so that it's not an overwhelming experience. It's an embodied experience. How am I doing so far?
You've just, do you teach Love Your Brain Yoga already?
Awesome. Great. Okay. And so when it comes to some of the other things to bear in mind in terms of the sorts of practices that you're doing, you've mentioned a cat-cow, you've mentioned some push-ups with the arms. What other sorts of things make their way in to recognize the common symptom clusters that people could be experiencing?
So big picture, I'll just also summarize. The 6-week intervention has an hour and a half, but that can sometimes be shortened. Of course, weekly classes that have 10 minutes of breath work for nervous system regulation and focus, 45 minutes of hatha-based, breath-centric yoga, sometimes in a chair, sometimes mat, sometimes hybrid mat and chair for groups of people of 13 with TBI and caregivers. Then 10 minutes, 10 to 15 minutes of meditation for mood and nervous system regulation. And then 20 minutes of group facilitated group discussion, with each class having a theme based on one factor that's been empirically shown to promote resilience. So for instance, one class is focused on this idea of realistic optimism, which is a concept that essentially means we are realistic about the fact that we'll experience challenges after, in life, but specifically after brain injury. But we also build a sense of self-efficacy that we're not going to get bogged down by the challenge, but can find a workaround and still find a feeling of possibility. So that theme is woven into the asana as well as the group discussion. And the meditation is chosen based on that. So we do in that practice a mountain meditation and really bring in an embodied sense of what it feels like to have a sense of strength amidst the changing environmental circumstances or internal circumstances. So to your question, though, around some of the other practice modifications or best practices on the asana side of things. So yes, having a sequence that builds a bit over time, but has a lot of consistency within it.
Yeah.
Having choices for rest throughout is really important, knowing cognitive and physical fatigue are common. So empowering people to choose what would feel most supportive for them is to remain in rest or to continue with movement throughout the practice. Chunking, so limiting transitions that are up and down because of how common it is to have challenges with regulating blood pressure. So starting supine, moving to all fours, moving to standing, and then moving back to supine. The transition for floor to standing, we call it T transition, which basically just means adding at least one extra breath. So when you're moving from like a forward folds, we also cue it so that people have the option, kind of the baseline is to keep your head above your heart, because forward folds, anytime the head is fully over the heart or below the heart, can cause dizziness and balance dysregulation for some people. So that halfway lift position, taking an extra breath before they rise all the way up to standing.
Great. I love all of that. That all sounds fantastic. I mean, a lot of that is how I would suggest that we teach many groups of people, if that makes sense.
Yeah.
Like
yeah.
the setting the environment at the beginning of choice, the minimizing really big transitions. For me, that's just an efficient way of working. You have your time on the floor, you have your time seated on or all fours, you have your time standing, you have your time coming back down, you have your time on the floor. I work mostly with older people, and minimizing those transitions is really sensible for them as well. Offering regular pit stops for rest and the option of staying. How do you feel? Do you need more? Or the option of continuing, I think, is also super sensible for lots of groups of people. And then the extra breath on transitions can be helpful for lots of people. I have low blood pressure, and that sort of whip up from a forward fold to a stand has never worked for me. So I always drop my hips and lift my head first. So a lot of this stuff to me is making sense. You talked about breath work and meditation too. You spoke about a really beautiful meditation of a mountain, the strength and endurance despite the world changing around it and changes to its physical form. I love that. I imagine, though, that there would be some delicacy in the practices that you choose when it comes to breath work and meditation, so that you are still creating a place that is safe and recognizes challenges with memory and processing. So, what are some of your favorite breath work and meditation techniques?
Well, before shifting to that, there's one other technique that I thought would be helpful to share here because it's been so widely. We've heard from so many people that it's been so helpful for them in terms of slowing down the delivery of cues and helping cognitively kind of prepare for movement. So I'll just touch on that quickly and then answer your
Yeah,
question.
please.
So there's a big emphasis on interoceptive cueing and certainly alignment focus from a safety perspective, but much more around rebuilding a sense of that sensory connection to how people are feeling internally. And what I found to be really helpful in our teaching team and teachers do out in the real world is use something that we call cognitive preparation cues, which basically means before cueing of movement. So say somebody was standing in Tadasana or standing and the goal was to invite people to lift their arms up towards the sides. So instead of from Tadasana, naming, as you might just simply lift your arms out towards the side, first sharing an interoceptive cue like notice the weight of your fingertips. Sense the touch of air on your skin. Is there warmth or coolness? As you're ready, lift your arms up towards the sides.
Mm-hmm.
And so just that extra step of adding an interoceptive cue brings cognitively someone's attention to that part of the body, and then it organizes more efficiently than the movement. So that's been a really helpful technique, I think, for teachers who sometimes, if you have more of a vinyasa background and are, using very floral or creative cueing, to simplify by just noticing a sense and then the direct cue around, lift up towards the sky as far as feels comfortable for you.
Yeah, super helpful. And I can imagine if your thoughts and attention are sort of anywhere in the room, anchoring them to sensation in the relevant body part first just sort of creates a funnel of attention so that there are now less things for you to focus on and less things for you to think about. And you just feel your hands, your fingers, or your feet, I presume, if you're about to do something standing. Yeah, that makes a lot of sense. I love that. I can see why people enjoy it.
Great. Okay. Just want to add that one in there. And so to your question around breath work and meditation. So our approach has been, in general, starting with some simple focused awareness meditation practices. So knowing that attention is so often compromised after TBI, starting small with noticing an anchor, giving options for one anchor that's internal and one anchor that's external, meaning giving an option to focus on the movement of breath, the natural weight of the body, or sounds around you.
Mm-hmm.
And then staying with that and really normalizing that if you notice your mind wandering, you are succeeding in the practice, and gently and with kindness, bringing your attention back to your anchor. So that has been that simple kind of foundational mindfulness practice has been really helpful for helping people regain some attention and also normalizing that the practice involves mind wandering, because especially after TBI, there can be such a heightened sense of I'm doing things wrong. I want to get back to how things used to be. So building in the language of gentleness and self-compassion is critical for a meditation practice. And open awareness practices where we're more allowing setting our attention free to notice whatever is passing through awareness can bring up a lot of kind of ruminating thoughts. So while that practice can be beneficial from a perspective of it takes it takes cognitive resources to focus. So it can be tiring to do focused awareness practices. So eventually, bringing in open awareness practices can be helpful from that resting in pure awareness. But the trade-off is it can exacerbate ruminating thoughts, which are often heightened after TBI. So I've found starting with some simple focused awareness practices for 2 to 5 minutes, and then over time, bringing in more open awareness has been kind of a helpful way of structuring, rebuilding attention, and then reducing the effort. And I think it can also be helpful. So we do progressive muscle relaxation, which we do a little more gently, knowing that an emphasis on interoceptive awareness, so rebuilding mind-body connection, just the sensing of embodiment, as well as improving nervous system regulation by doing a little activation of the sympathetic nervous system when you're holding, like squeezing the muscles, and then softening, releasing them, and really allowing parasympathetic nervous system activation to then shift, and noticing the difference between both sides of both experiences of ease and intensity, or effort and relaxation. That's also been a really helpful practice, but the emphasis is not on squeezing really tightly. It's really more about the language I'll often use is like, notice your hands as you're ready, gently squeeze your fists, sense how this gentle effort feels in your body. Continue to breathe naturally as you sense what this effort feels like. Then as you're ready, release all effort. Arms heavy and at ease by your sides. Notice how it feels to move from effort to ease. And that's been a really helpful practice, both because sleep disturbance is so common also after TBI, and progressive muscle relaxation has been found to be helpful, especially before sleep, for I think the general population, but also after TBI.
Yeah, and I guess we spoke before we started recording about the importance of taking things out into the real world, right? So if you can do something in a class setting, that's great. You'll leave feeling different. But if you can take tools from that into feeling dysregulated at home or lying in bed trying to get to sleep, that's where the changes really ripple out and start to flow on into your wider life, right?
Absolutely. I mean, a huge emphasis in our Love Your Brain yoga program, where we at the height of the program before the pandemic, we partnered with 60 yoga studios across the US and Canada. I think we were in 35 US states and 10 Canadian provinces. And now the program is exclusively in hospitals and neurorehabilitation facilities. We have about 16 partners still in the US and Canada. But so much of the emphasis was build a sense of tools that you can weave into daily life to support with the complexity of challenges that happen after TBI, but also really build relationships that can sustain and support you to dismantle some of the social isolation that happens and rebuild a sense of community connection that's so vital after TBI, which impacts identity and has such a ripple effect on people's lives. So,
and breath work, I'm guessing you start in a similar way, like you're not going to go from nothing to Bastrika. You'll probably start with some simple breath awareness, I'm hoping.
Yes. So same approach, start small and then offer different options over time. So simple breath awareness, we do a simple breath count to help with a little bit of the diaphragmatic breathing, but counting up to 2 and then counting down to 2. So simple counts, but from, the kind of sum-of-RT approach of trying to equalize nervous system and equalize breath counting. That's been also helpful for attention and self-regulation. And then using some tactile elements, so that can also be helpful. Hands on the belly. If you're doing a 3-part breath, we also do a 3-part breath. in our curriculum. So having one hand on the heart, one hand on the belly, and cueing the sensation of touch as the breath moves to those different parts of the body. Do also an Ujjayi practice that we start by just having people notice a sense of sensation on the back of their throat when they're sighing, and then giving the option for people to halfway through the exhale begin to close the mouth and feel what it feels like in the throat as they breathe out their nose. So just simply going, and then giving the option for people to do the full practice of keeping the mouth closed, breathing out the nose, and just focusing on the exhale. So really using that as a way of activating the parasympathetic. So that's part of the practice, the curriculum.
And I can feel the through lines coming all the way through with space and choice, with interoceptive sensation always is the anchor of feeling into the body. And a lot of nervous system downregulation, which it makes sense. It's kind of what everybody seems to need at the moment. But you did mention as we were preparing for this conversation that not everybody with traumatic brain injury needs to be downregulated all the time. So are there some scenarios where people need upregulation?
Yes. And this is, I think, a really important topic to weave into the conversation around nervous system regulation, because there, for good reason, is also often a privileging of downregulating. But what can happen after TBI is there can be more hypoarousal. So people can feel more depressive symptoms, a lack of motivation, challenges with a sense of energy. So having also the tools to support with I think we were talking about the window of tolerance. So our ability to manage stress day to day, if we're within our window, we're able to skillfully respond to the daily stressors of life. After TBI, that often gets impacted so that people can be more hyper aroused, easily irritable, feeling overwhelmed, heightened stress response, but it can also go to hypoarousal. So having also some breath work that increases energy. And one that we've sometimes used is a kind of, I think we learned this from, I think this was from an IRS practice, but using a Kapalabhati where it's a little bit slower, but there's still a bit of energetic activation. So emphasizing the exhale, but doing it very gently. So it would look something like, I don't know if you can hear that, but this idea of still emphasizing the short exhale, longer inhale, that can help boost a little bit of energy, which is important after TBI especially for the component of people that face challenges with energy, lack of motivation, and need tools to kind of boost actually sympathetic nervous system response.
And is that something you teach with the group and then encourage people to notice how they feel and to give them guidance as to when they might use that? Or is that something you'd use more selectively with individuals?
More selectively. So we are in our group-based standard curriculum offering meditation and breath work that is emphasizing more downregulation. But this is something that if I'm noticing or someone shares more with me that they need more practices to help with energy, focus, motivation, that is a practice that's been used, that I have used and have found to be helpful for some people with TBI.
Great. So I think if we're starting to get toward a summary here, you've shared so much really useful information, not just about the background, but about what we can do with that in a yoga setting. And so the things that I'm taking out are the social aspect of having a group of people together who will have some similar and some contrasting and some overlapping challenges, but a sense of being in this with other people and not just by themselves is crucial. So the social aspect that I think so often gets overlooked in a more rigid kind of medical model is just people being together and sharing experiences has its own kind of power, and not to forget that. And then you have meditation, movement, breath work, and then the sharing, the sort of guided conversational aspect that lets people get that more social input and maybe gives them some ways to start thinking about that not being an isolated practice in the room or on the mat, or as something they might take out with them. When it came to meditation practices, movement practices, and breath work for that matter, anchoring them to the physical, really emphasizing interoceptive and felt sensation to give people an anchor back into their body and to give them something to focus cognitive attention on, keeping cueing concise, with space between for people to process that information. And I imagine keeping the practice relatively simple too, a lot of it familiar and repeated through the 6 weeks so that it's not something new to learn every single time, but coming back to things that you've done before. And that in itself being an easing of cognitive burden. Cueing transitions more slowly, especially those that involve a change in position or elevation that could influence vestibular symptoms, giving an extra breath. And cueing movement in general more slowly, cueing to the part of the body that is going to move first, letting them anchor sensation there, and then creating the movement. And I feel like I'm forgetting some stuff, but those were the through lines for me. What have I missed?
I'm just beyond impressed that you were able to.
My test for myself. I know I've missed some things, but there were some really powerful takeaways. Anything big that I missed out that you want to reinforce before we wrap things up?
No, I think you highlighted things beautifully.
I'm really tempted to go do the training now. It sounds fascinating. I just need to find some people with brain injuries, which, as I said, should not be difficult in my town, given the prevalence of skiing and mountain biking injuries and icy roads and all the horrible things. So in terms of resources to send people to, we've got LoveYourBrain.com, which I will link to in the show notes, obviously. We've got the previous episode with Dr. Dia Grant. If you're interested in concussion specifically, feel free to head to that episode. She also has a short course online with Yoga Medicine on yoga for concussion care. And we also have an episode on trauma-informed yoga with Dr. Ann Bortz for people who are specifically interested in the PTSD and trauma side. Anything else you would like to share resource-wise for people watching or listening?
Well, the only thing two things. I think now I'm so curious because TBI and concussion are so common. You have all the listeners out there, you have people with these conditions in your class. So if you feel like you don't know anybody right now, I guarantee that as soon as you go into your class and you maybe start talking about this, that will surface more and more. So I just feel very grateful that you're interested in this topic and subject. And certainly if you'd like to learn more, we do offer online 20-hour certification level trainings in how to adapt yoga in all of its facets, as well as deliver the Love Your Brain yoga curriculum in your own context. So hope that we can be a supportive resource. And I'm always looking for different research partnership ideas. So please reach out to me if that also piques your interest, as well as how we can work together to bring these practices into more clinical spaces as well.
I think you found the right people. I mean, yoga medicine people are super nerdy. They love learning. They love the brain. So I think you probably found your people here. So yeah, if you have ideas, get in touch, head to loveyourbrain.com. Well, thank you so much. Thank you so much for sharing your time and your thoughtfulness, your experiences and your expertise. I think there are lots of really juicy takeaways there for people, whether they know that they teach people with brain injuries or not.
Thank you, Rachel. Much appreciated.
Thank you. Thanks for listening to Yoga Medicine. If you liked the show, be sure to subscribe and leave a rating and review on Apple Podcasts or wherever you listen to podcasts. And if you got something out of this episode, please spread the word and share it with a friend. You can find more information, articles, trainings, and classes at yogamedicine.com. Check us out on social media as Yoga Medicine, or you can email us at info@yogamedicine.com. Thank you for being part of our Yoga Medicine community.
The content of this podcast is not medical advice and is not meant to replace medical care. Please consult your healthcare provider to determine what is best for your unique healthcare needs.